So today I would like to talk to you about what you can do if you experience an episode of low back pain. So the first thing you should do is assess the severity of your symptoms. If you're experiencing extreme symptoms, 9 out of 10 pain, 10 out of 10 pain, constant symptoms where you don't even have a second of relief from that extreme pain, and you might experience profound weakness of your legs or numbness in your legs that prevents you from standing and walking. You may lose control of your bowel and bladder. That is a medical emergency. You need to seek medical help immediately. Okay? Shut this video off and go do that if that's you. However, if that's not you, and you probably aren't because you're watching this video, you're in a mild to moderate episode of pain. This would be pain symptoms that are intermittent in nature, where your symptoms will increase or decrease depending on the movement that you perform or the position that you're in. The next thing you should do is assess the nature of your pain. What I mean by the nature of your pain is describing the location of your symptoms, whether you feel them right at the level of your lower back or you feel them spreading away from your back. You may feel symptoms that actually go down your thigh to your leg. What does it feel like? Is it a pain sensation? Is it a burning sensation? A feeling of pressure? A feeling of general discomfort? Some people feel a hot or a cold sensation. What are you feeling? And also, what are you feeling when you perform different activities? How do you feel in sitting versus standing? How do you feel when walking versus when you're still? Is there a position you can lie down in that feels better or worse? This is the nature of the pain. And so, after kind of coming to a few conclusions about that, this is the prone progression, or it's a series of movements that typically help people recover from an episode of pain. And so what that means is prone means to lay face down on a surface. And so the first thing you can try is to lay down on your stomach. Before you begin, you want to make sure that the surface you're going to lay on is at least somewhat firm. If you have a firm mattress, that should be fine. If you have a yoga mat or you have a medical table like so, that would be even better. Typically, a soft mattress is inappropriate because it will sag and will defeat the purpose of what we're trying to do here. So to begin, you come on down very carefully, supporting yourself with your arms and your legs, and gently lower yourself down onto the surface of your table. You're going to want to allow each arm to go to the side of your body and then relax. If this is a little bit uncomfortable for your neck, you can bring your hands up to support your head, either straight on like so, or gently to the side. And so you'll want to stay in this position for up to 30 seconds to see what the response is. If you find that you're uncomfortable or that your symptoms are getting worse, you'll want to abandon this position. When you lay down on your stomach, you're just relaxing, and your spine is in a neutral position, if not slightly extended or into a very minimal back bend. If you try this lying position on your stomach and find that it's getting easier, there's less discomfort as you stay there, then that's great. You can progress to the propped up on your forearms position. To progress to the prone on forearms position, you will bring your arms up underneath your upper body like so that your forearms and elbows are supporting your upper body, and you are now in a slight extension or back bend of the lower back. In this position, you can hold for up to 10 seconds or up to 30 seconds and anywhere in between, depending on how you feel. If your initial response is discomfort, then you may only want to hold for a 10 count, and then go ahead and relax back on down to the prone and lying position. You'll want to repeat this procedure at least 3 to 5 times to get an idea of what the true response is to this. Typically, people will feel looser after getting into this position and performing it a few times over and over again. If you found that after performing the propped up on forearms position that your lower back is feeling better, that your symptoms are improving, that you're loosening up that area, then you may progress to the extension in lying exercise. To progress to the extension and lying exercise, you'll want to bring one arm underneath each shoulder, like shown. And then you're going to push your body upward and extend your elbows so that your lower body stays relaxed on the table and the rest of your body comes up so that your lower back goes into a back bend. You hold for about 3 seconds, then come on back down to the starting position. You'll want to repeat this 5 to 10 times to see what the true response is. You may find that as you continue to perform this movement, that the movement gets easier, or that the tissues feel looser, and you feel less discomfort. If you find that this is not happening, that you are feeling greater discomfort and pain, then you'll want to abandon this procedure. After having performed the extension and lying movement, you should assess the change in your status at this time. If there was a movement or a position that before had bothered you a lot, or was really painful, or was difficult to perform, you should now attempt to perform it carefully and see if the way you feel is any different at this time. If you got through the entire progression and found that you were improving, there's a good chance that things that were more limiting and more painful before may be improved now. They may not be perfect, but if you see an improvement, that means that you're heading in the right direction. And so let's discuss why the prone progression might be beneficial to someone who has experienced low back pain. For most individuals, they injure their lower back, their spinal tissues, because they are flexing the spine too much. And by flexing, I mean a forward bend, a rounding of the back forward. This can either be done in a sustained way, either by sitting or finding positions where the back is rounded for extended periods of time, or by repeatedly moving into a bent position or flexing, such as reaching to the floor and picking up objects, or a combination of both. Most individuals don't restore the natural motion of the spine by leaning back into an extended position. And so when you perform this prone progression, you are restoring the back bending ability of the spine that is sometimes lost. And the reason why that is lost is because the back of those spinal tissues are injured by all that repeated forward bending moves or forward bending position. And so by moving in a backward position, you're helping to push the displaced tissue back to its natural state, which then can allow you to recover from your episode of back pain much faster. I hope that you've learned something from this video. Thank you very much.